Hello everyone, I am Dr. Rashid Hassan and today I am going to talk about amalgam versus composites. Well, the objective of today's lecture is to compare the two most commonly used restorative materials head to head in dentistry. I will be discussing both of these restorative materials one by one under the same headings in order to get a thorough understanding and an in depth comparison of both of these restorative materials. So, let's get started. So, first of all, is the definition. Well, amalgam is defined as a mixture of silver alloy and mercury. Well, the silver alloy it is composed of several other metals as well, like tin, copper, zinc, platinum, palladium, etc. It is mixed with the liquid mercury to give dental amalgam. Talking about the definition of the dental composites, it is a highly cross-linked polymeric material which is formed by two distinct phases. One is the continuous phase, which is formed by the organic polymer, and the second one is the dispersed phase, which is formed by the inorganic component of filler particles. Well, the main idea of the composites is to get a material which has the properties which are either intermediate or superior to the individual components used in the composition of dental composites. Now, talking about the composition, well, dental amalgam is a powder liquid formulation. The powder is a silver alloy and the liquid is mercury. The silver alloy it contains silver, tin, copper as the major components, whereas the zinc, platinum, and palladium these are the minor additions. Well, each of these components they give specific properties to the dental amalgam. Like silver, it increases the strength, setting expansion. It increases the resistance to tarnish. It also helps to whitens the alloy. Then talking about the tin, it controls the setting reaction of silver alloy with liquid mercury. Copper increases the strength and the hardness of the dental amalgam. Then talking about zinc, it acts as a deoxidizing agent or a scavenger. Platinum and palladium they increase the hardness of the dental amalgam and they also help to give the grayish color to the dental amalgam. Now let's talk about the composition of dental composites. Well, it is formed by four major components. First one is the organic component, which is polymer matrix. The second one is the inorganic component, which are the filler particles. Then a coupling agent which helps to bind organic component with the inorganic component, and lastly the initiator activator system. In cases of chemically cured dental composite, it is benzyl peroxide and tertiary amine, whereas in case of light cured dental composite, camphorquinone is a photoactivator which is activated by blue light in the wavelength of 470 nanometers, which helps to polymerize the light cured dental composites. The third heading is the classification. Well, based on the copper content, the amalgam is classified into low copper or high copper dental amalgam alloys. Well, low copper alloys have the copper content less than 6%, whereas the high copper dental alloys they have a copper content in the range of 6 to 30%. Secondly, on the basis of zinc content, amalgam alloy can either be zinc containing or zinc free alloys. Zinc containing alloys, the amalgam alloys, they have zinc content more than 0.01%, whereas if the zinc content is less than 0.01%, it is called as zinc free amalgam alloy. Then, based on the shape of the alloy particles, a dental amalgam can either be lathe cut, spherical, or admixed. Lathe cut are irregular particles, whereas sphericals are regularly shaped particles, and admixed is a combination of lathe cut and spherical particles. Now, talking about the classification of dental composites, on the basis of curing, dental composites can either be light cured, chemically cured, or dual cured dental composites. Light cured dental composites has photoactivator camphorquinone, which is activated by blue light in the wavelength of 470 nanometers, whereas chemically cured it is available in two paste system. One is the base paste and the other one is the activator paste. Benzyl peroxide is the initiator, whereas the tertiary amine is the activator in chemically cured dental composites. Then there are dual cured dental composites. It is a two-paste system in which first the two pastes are mixed and the chemical polymerization reaction starts, and then it is inserted inside the tooth cavity, and it is activated by a blue light, and then the light cured polymerization starts. So since it is cured by both of the means of light cured and chemical cured, it is called as dual cured dental composites. Then on the basis of the size of the filler particles, they can either be conventional, having the particle size of about 50 micrometers, then small particle filled dental composites, microfilled, and hybrid dental composites. Well, all these four categories, they are based upon the size of the filler particles. If we compare the availability of dental amalgam and dental composites, dental amalgam is available in the silver alloy powder and liquid mercury bottles. It is also available in the capsule form, in which one of the compartment there is silver alloy and in the other compartment there is liquid mercury, which is separated by a very thin membrane. Then it is also available in the pre-proportioned sachet form. Then talking about the availability of dental composites, in case of light cured dental composite, it is available in the syringe form, whereas the dual cured and chemically cured dental composite, they are available in the paste-based formulation. Now let's compare the indications of dental amalgam and dental composites. First, the dental amalgam. Well, it is indicated in moderate to large class 1 and class 2 posterior restorations. Then dental amalgam is indicated in class 5 restorations where aesthetic is not a concern. Dental amalgam is also indicated as a core build-up material or as a retrograde filling material in case of episectomy. It is also indicated in moderate caries control areas. Now talking about the indications of dental composites are indicated in all the six classes of GV Black's classification. It is the material of choice in case of the aesthetic dentistry, where partial and full veneer are needed. In cases of severely mobile teeth, dental composite is also used as a splinting material to splint the teeth. Now let's compare the contraindications of dental amalgam and dental composites. Dental amalgam is contraindicated in the aesthetic concern areas. It is also contraindicated in extensive loss of the tooth structure because we can't get the mechanical retention from the walls of the natural tooth if the tooth structure is lost quite extensively. Dental amalgam is also contraindicated in small class 1 and class 2 cavities because even for the small cavities we have to make the specific design for the amalgam restoration. So it's better to choose some other restorative material in case of the small class 1 and class 2 cavities. Now let's talk about the contraindications of the dental composites. It is contraindicated in the abnormal occlusal stress areas. In case where the patient has a poor oral hygiene, dental composites are also contraindicated because if due to the poor oral hygiene, the filling will discolor with time. In the areas which are difficult to access or where the isolation cannot be done properly, dental composites are also contraindicated because the dental composite won't bind with the tooth structure if there is any compromise on the isolation, or where it is difficult for the light to access. Then the patient which are allergic to the polymeric component of the dental composites are also contraindicated in those patients.